2 minutes can seem like an hour when you have a critical patient that you need to get to a trauma center. It can be difficult because you try to stabilize the patient, also the family members. Time is a big factor, so you want to try to get to your appropriate facility as fast as possible. Typically, we could drive 40 minutes to an hour.
It is important for Grandview Health to pursue trauma center accreditation to provide a service and care for the patients that currently does not exist in our community.
This community needs a level 2 trauma center because injured patients, the ones that actually die of trauma, die usually in the first hour from injury. So that transport time is really critical.
When patients are transferred out of their home areas, it provides an added burden to the families.
We've been working behind the scenes for over a year preparing for this. I am here predominantly at Grandview as the trauma director and section chief, but I am also part of the Penn Trauma Network.
They're one of the nation's leading experts in trauma care across the region and also the country. They brought us surgeons that will be staffed here 24/7. They brought us clinical expertise, including policies, procedures, training, educational opportunities, and they're here with us as our partners as we implement Level 2 Trauma Center.
It really helps to have a team behind the team to kind of help support and cross-check and make sure that we have everything ready.
We'll see car crashes, motorcycle crashes. We can see industrial accidents, farming accidents, and a high number of falls.
Many patients are actually in the elder group. Many are on anticoagulants, so it's very common for them to get, say, a bleed in the head that might need an emergent intervention to save their life.
Neurosurgical services will be available 24/7, 365 days a year to make sure we're taking care of trauma patients and non-trauma patients that need neurosurgical interventions.
We're adding services, including trauma surgeons, neurosurgeons, increasing our clinical staff, providing education, and the technology that makes sure that we're ready to care for every patient.
When we think about trauma and we think about the types of problems that can happen when people say are involved in car accidents or falls, a lot of times patients will injure their brains or they'll injure their spine. It can be fractures, it can be injuries to the brain itself, it can be injuries to the spinal cord or the spinal column. That's where neurosurgery steps in and shines.
Adding a trauma program is not just about the people, although they're the most important part. We have to have the facilities ready to care for patients 24/7.
We're building a new building which is going to have state-of-the-art trauma bay and emergency room. In addition, it's going to have new patient floors and new ancillary service areas. So all the service lines are going to both improve in their capability and their ability to deliver care to the patient.
The best part about being a community hospital is being there ready to take care of the community, whatever their need is, whether they're having a child, whether they're injured, whether they're having a heart attack or have cancer. And patients who are injured here can now stay locally and be taken care of in our community.
Every patient that is seen at Grandview Health will benefit from trauma center accreditation.